Hi everyone, this is Mr. Neil Writer, also known as the Wax Whisperer. Thank you for tuning in to my latest video. For anyone who doesn't know who I am, I'm a UK-based, multi-award winning consultant audiologist and a clinical ear care specialist. Um, I'm also a co-founder of a company called Clearwax, Ear Wax Removal Specialist, and Clearwax are the manufacturers and developers of the device that we're using in these videos called the iClearScope. So the iClearScope is a wireless otto endoscope, and we specifically and specially designed an endoscope for the specific purpose and intended use of earwax removal. So the endoscope itself, the eyepiece we attach to an iPod via an adapter, and there's an app developed by Endoscope Eye which kind of blows up the video on the screen, and that's what we're looking through right now, and it's the exact same view that you're viewing now is the exact same view that I view during performing the procedure. This is the patient's left ear. Now I actually started with the right ear in the actual main procedure, and you probably noticed when I went in with the suction probe there was a bit of debris there, so don't worry, this wasn't used between patients, it's just because I flipped it around and I'm showing you the left ear first. So when we're performing procedures in both ears, just as long as the patient doesn't have an infection in one ear, we can use the instrumentation for both ears. Obviously, we dispose of that, they're all single use in between patients. So just showing you the left side first. So the patient has bilateral, fully occluding, very glutinous earwax. So very sticky and glue-like texture, which makes it sometimes difficult to use a suction probe because it blocks the suction probe. It's like thick mud basically. So just using a Jobson horn here, we're near the entrance and we're on the posterior lateral canal wall. You can just see how glutinous that is. It's almost like a very thick mud gluey substance. So just lifted it off the posterior canal wall and I went into the wax. I went back in, got some leverage, and I'm just pulling this out. It's sticky, it's gooey, and this type of wax can cause significant deafness in the ear because it really compresses against the canal walls and it sticks. So there's very little air gaps there for a bit of sound and air to enter. So just working at the entrance here, you can see the heft or the cilia. So when you see the cilia in the ear, it means we're near the entrance. Just slowly bringing this away. And the wax has been there for a long time. You can see the colour of it is quite dark. So the darker the wax, typically it's oxidized. So I've just managed to retract this on the posterior canal wall. There's a big opening there now for me to insert the Jobson horn in and behind the wax and get this out in a big chunk. You can see there's a few loose hairs there as well, so it's matted. So this wax is literally hanging out the ear. That's the entrance where I've inserted the Jobson horn, just levering the last piece out. And there's the eardrum, lovely and healthy. Just mopping up near the entrance. So with glutinous wax, it's quite syrupy, honey type consistency, so it does stick to all the hairs near the entrance. I'm just giving that a good mop. And there's the final view. Now onto the right side. So the right side, the entrance is a bit narrower. So I'm just trying to, again, just to see if a suction probe works, but again, the wax is quite glutinous. However, it was sucking a bit better than for the left side. So you would have noticed the suction probe here, it's crystal clear. So we actually did the procedure in the right ear, but I had two different videos, and when I was uploading it and editing it, it was the wrong way around, and it was just, by the time I edited it, I realised it would be too much of a faff to kind of invert the two videos because there's many different edits and cuts. So just with this ear, because it was quite narrow, I've put the endoscope just at the entrance of the ear canal past the hairs, and I'm stretching the ear to the left to widen the ear. So that not only enables me to get the view that I want, but it also opens up the ear canal entrance so I can set the instrument. If I didn't retract the ear open, if I didn't stretch it, so it's almost like a crowbar effect, widening the ear to obtain access, I wouldn't be able to get this instrument really in the ear. And I'm just tugging away at this, bringing it forwards, and you'll see in a moment the wax gets trapped near the entrance because this plug of wax, the ear canal entrance is narrow, but once you're in the ear, it does widen and straighten. So we're bringing out a large piece of wax through a narrow entrance. Imagine, I don't know, trying to think of something bigger than a basketball, but imagine you've got an extra large basketball and you're trying to do a slam dunk, bringing it through the hoop. So that basketball's too big for the hoop, and obviously a basketball is very hard and firm. With the wax, it's slightly more malleable, but in essence, we're trying to bring a large piece of wax. The diameter of this wax is larger than the diameter of the entrance. You can see there, we're just at the entrance now. All those hairs are in the way. Those hairs mean we're more or less lateral near the entrance, and that's the entrance of the ear canal. So I brought it forwards, and similar to the other side, it was a bit glutinous. I'm just trying to wriggle this through a bit more. So the wax at the top is a bit firmer. So this wax, although it's soft, there is patches on there where we can get a suction grip. And again, the endoscope where I'm holding it, there's nothing supporting this. So my left hand is completely mid-air here. The endoscope's not in contact with anything, so it's quite a difficult thing to do. You've got two hands, your right hand doing all the manipulation, and the left hand you have to keep really still. We don't have a tripod, we don't have a cameraman holding that. When you're removing wax deep in the ear, obviously the endoscope enters the ear canal. You can rest it against the cartilage, the base of the ear canal, the posterior part of the ear canal, but here I'm literally just holding it. So I'm making these hand movements, and obviously when you're moving one hand quite vigorously, your whole body kind of moves, and the patient's head can move, but we're just trying to keep as still as possible with the left hand, which is quite tricky to do. Just a gap at the top, and I think I'm going to, in a moment, go in with an ear hook just to get in behind that. So I've managed to remove this big plug of wax here, but there's still a lot more, and this is quite medial. So again, enter the ear using the eye clear scope, stretching the ear to the left. You can see now it's widened, and I've got the view that I want. Whilst keeping my left hand really steady, keeping that ear open, I'm then going in with my right hand, sucking this wax out. You can see it's just, again, similarly to that first plug of wax, that wax was larger than the entrance, so as I was extracting it, kind of dissected in half. Lovely clear medial part of the ear canal, so medial is near to the eardrum. Eardrum's textbook, nice and healthy. Just mopping up some of this soft wax near the entrance. It's not going to be problematic for the patient if I left it there, but it's on the cartilage portion, just gently lifting that. Again, just mop up near the entrance where all the hairs are, all the cilia. And in a moment, just inspecting. So when we go into the ear, there's always a bit of a blind spot to the left hand side, to the rear. So I'm just examining that part of the ear, just mopping up. There's a little valley here as well near the entrance, so you can always get a bit of soft sticky wax there. And there's the eardrum. So you'll see a still image of all the contents of that. Quite a lot of wax, as you can see. Hope you enjoyed that video, guys. I think that's the last one for today. I think that's 5 in the trot. They do take quite a while to edit and upload and narrate over, so it's 6:30 UK time. I'm gonna go home, have some dinner, and put my feet up, watch a good movie on Netflix. Hope everyone is going to have a similarly relaxing evening. If you're watching on YouTube for the first time, please do subscribe to the page, select the bell icon so you'll get notified as and when I upload new videos. If you're watching on Facebook or Instagram, similarly follow the page, feel free to leave a comment and like the video. Thanks guys, have a great evening, bye.